Hey there and welcome. If you're looking into IVF, you know it's a journey that's incredibly personal. And let's be honest, it can feel pretty complicated. So today, we're going to pull back the curtain on all of it. We're going to break down the process into simple, clear steps, covering both the science and, the human side of it all. Let's get started. Before we dive into the nuts and bolts, I really want to start with this quote, because this is what it's all about, right? The whole point of any fertility journey should be rooted in compassionate care. It kind of sets the tone for everything we're about to talk about. It's this blend of cutting-edge treatment with a truly supportive human touch. It is completely normal to feel a whole mix of things. Hope, a bit of anxiety, maybe even some confusion. And that's exactly why we're doing this. We want to do two things. First, walk you through the medical stuff so you know what's coming. And second, we want to talk about the emotional side of the ride, because that is just as important. So where does this all even begin? Well, before you get to the main procedures, there's this really crucial preparation phase. Think of it as laying the best possible foundation for everything that comes next. This first stage is all about meeting with your medical team, getting a clear diagnosis, and making a game plan. You'll get up to speed on key things like egg quality, and you'll talk about how to get ready, both physically and mentally. This is also the perfect time to rally your support system and really understand the specific treatment plan your doctor is creating just for you. All right, let's get into the nitty-gritty, the IVF cycle itself. It might seem like this one huge, mysterious thing, but it's really a series of well-planned steps, and each one has a very specific job. The best way to think about the IVF process is like a 5-step roadmap. It kicks off with ovarian stimulation to get the eggs ready. Then we move to egg retrieval. After that, the magic happens in the lab with fertilization and embryo development. And the final stop on the map, the embryo transfer. Now, let's zoom in on each of these. So step 1 is ovarian stimulation. Now, your body normally just produces one mature egg each month. The goal here is to use medications to, encourage your ovaries to produce a whole group of mature eggs. It's all about maximizing the potential for that one cycle. Once those eggs are ready and mature, it's time for the retrieval. I want to be clear, this is a short, minimally invasive procedure. You'll be under sedation, so you'll be comfortable and relaxed while the doctor carefully collects the eggs. Okay, once the eggs are safely in the lab, it's time for fertilization. Now, this can happen a couple ways. Sometimes the egg and sperm are just put together in a dish to do their thing. But in other situations, they use this incredible technique called ICSI. An embryologist literally picks out a single healthy sperm and injects it right into the egg. It can be a total game changer for certain fertility challenges. So after fertilization, the new embryos start growing in the lab. A blastocyst transfer means we wait until an embryo has been developing for about 5 days. So why wait? Well, that extra time in the lab is like a natural quality check. It lets the embryology team see which embryos are the strongest, which helps them pick the one with the very best chance of success. But what happens if you have more high-quality embryos than you transfer in that cycle? That's where cryopreservation or embryo freezing is such a big deal. This amazing technology lets you safely preserve those extra embryos for the future. It gives you more chances down the road without having to go through the whole stimulation and retrieval process all over again. So we've just walked through all the science, all the medical steps, but anyone who has ever been through IVF or even thought about it knows it is so much more than that. It's a deeply emotional experience. So now, let's shift gears and focus on the heart of the journey. This part of our guide is all about the emotional and psychological side of IVF, which is every single bit as important as the medical stuff. Your emotional well-being is a huge piece of this puzzle. We're talking about managing some very real stress and learning how to sit with the uncertainty of it all, which can be the hardest part. This journey can definitely put a spotlight on your relationships, and it changes how you talk with friends and family. It's also about finding the strength to handle potential setbacks. Just knowing that all these feelings are normal and valid, that's the first and maybe most important step. Okay, so after the embryo transfer, you enter what's famously or maybe infamously known as the 2-week wait. It's that period of time between the transfer and your pregnancy test, and it can be a really intense mix of hope and anxiety. So while you're waiting and wondering what's actually happening in there, let's break it down. Day 0 is the transfer. Over the next 5 days or so, that little embryo starts the process of implanting. Then from about day 6 to 11, it keeps developing and starts producing HCG. That's the pregnancy hormone that the test is looking for. During this waiting period, it's so important to just follow your clinic's instructions. You might have heard about strict bed rest, but honestly, a lot of studies show it isn't necessary. It's more about finding a gentle balance. The best thing you can do for yourself is focus on self-care, do things that reduce stress, and just try to prepare emotionally for whatever the result may be. As we start to wrap up, let's look forward for a minute. Because the world of fertility treatment is not standing still, not at all. There is this constant wave of new ideas and research bringing fresh hope to people all over the world. You know, the science that makes all of this possible is one of the fastest moving areas in all of medicine. Seriously, what seems like science fiction today could be totally standard in just a few years, offering better and better chances of success. So what's coming next? Get a load of this. Scientists are using artificial intelligence to help pick the healthiest embryos with incredible accuracy. There's really promising research using stem cells to potentially improve ovarian health. And maybe the wildest of all, new technologies are being developed to correct genetic problems in embryos before they're even transferred. The pace of innovation is just wow. So we want to leave you with a question to take with you. This whole journey is really a story of science, of resilience, and more than anything, of hope. And as you move forward, one step at a time, it's worth thinking about what does that hope look like and feel like for you? Thank you so much for joining us.